So you get an order for an antidiarrheal. Seems pretty straightforward, right? But what if I told you that giving that simple med without thinking could cover up a massive, life-threatening emergency? Well, in this explainer, we're going to cut right to the chase. We're talking about the critical safety alerts you have to know for your exams and for keeping your patients safe. So let's jump right into the single most important warning you need to hear. Okay, listen up. You need to burn this into your brain, seriously. That liquid stool you see, it might not be what you think. It could actually be the only sign of a huge, life-threatening bowel obstruction. Imagine a big blockage, and the only thing getting past it is this little bit of liquid seeping around the sides. This is exactly why we never just blindly treat a symptom.
So, what does that mean for us? It means our #1 rule, always, is to assess before we medicate. Think of it like this. You're a detective first. Giving a med to stop the diarrhea is like running over and cutting the wires to a screaming fire alarm. Yeah, you stop the noise, but the fire, in this case maybe a bowel perforation or trapped toxins, is just getting bigger. Your job is to find the fire, not just silence the alarm.
All right, to make the right call, you got to know what's in your toolkit. We're going to break down the 3 main types of antidiarrheals. I like to think of them as the sponges that soak up the bad stuff, the brakes that slow the whole system down, and the reinforcements that bring in the good guys. Let's start with tool number 1.
Okay, first up, we've got the Adsorbents. Think of these as the cleanup crew. Their whole job is to get in there and basically soak up whatever is causing the trouble.
And the most famous one here is, of course, bismuth subsalicylate. You know it as Pepto-Bismol. It's pretty cool, actually. It does 2 things. First, it acts like a magnet, grabbing on the toxins and bacteria to get them out of there. And second, it helps calm down that inflamed, irritated gut lining. But, and this is a big but, this cleanup crew has some really serious warnings you need to know.
All right, these are your absolute, non-negotiable red flags. Bismuth subsalicylate is basically a cousin of aspirin. That means you cannot give it to anyone with an aspirin allergy, a bleeding ulcer, or if you see any blood in their stool. Period. Why? Because you could take a small bleed and turn it into a massive hemorrhage. It's that serious.
Okay, big flashing lights here. NCLEX alert. I guarantee you'll see a question like this. A kid has the flu or chicken pox, and they also have diarrhea. The question wants you to pick Pepto-Bismol. Don't. It's a trap. Giving it can trigger Ray's syndrome, which is this horrifying condition that causes the brain and liver to swell. This isn't just an exam trick. This is a life or death call. Don't ever get this wrong.
Now, let's talk about a side effect that looks absolutely terrifying, but is actually totally harmless. And you have to teach your patients about this, or they will freak out. The bismuth can mix with a tiny bit of sulfur in their saliva or gut and temporarily turn their tongue or their stool black. You need to look them in the eye and say, this might happen, it's not blood, it's normal, and it'll go away when you stop the med. That little bit of teaching will save you a panic call at 3 a.m.
Okay, moving on to tool number 2, the antimotility drugs. So if the adsorbents were the cleanup crew, think of these guys as the heavy machinery. Their job is to slam on the brakes for the entire GI tract.
I mean, the name really says it all, right? Antimotility. These meds work by directly slowing down peristalsis. You know, those muscle contractions that push everything along. So we slow down the waves, and we get less diarrhea. Sounds simple, and there's always a but, this comes with some major risks.
So the 2 big players you'll see are loperamide and the anticholinergics. Now, I need you to focus on the risk for loperamide. This is not some rare theoretical thing from a textbook. An overdose of loperamide can and does cause fatal cardiac arrhythmias. You absolutely have to remember this.
And for loperamide, here is another hard and fast rule. You never, ever, ever give it to a child under the age of 2. Their little bodies just can't handle a drug that slows down the gut this powerfully. The risks are just way too high. We're talking things like respiratory depression or a paralytic ileus, where the bowel just stops working. Just don't do it.
Okay, let's talk anticholinergics. For your exams, this is one of those lists you just have to memorize. You do not give these meds to patients with narrow-angle glaucoma, myasthenia gravis, or a paralytic ileus. And the reason is simple. The drug will make every single one of those conditions worse. You could literally take a stable patient and push them right into a medical emergency.
All right, let's switch gears completely. Our final tool works in a totally different way. Instead of absorbing toxins or slamming on the brakes, this approach is all about calling in reinforcements, the good guys. We're talking about probiotics.
And the classic example here is lactobacillus. The way it works is super simple. It doesn't actually stop anything. It just restores balance. You're basically putting good bacteria back into the gut, and those good guys help crowd out the bad bacteria that are causing all the trouble. It's all about rebuilding the body's own defenses.
And this right here is a huge takeaway for probiotics. I mean, after all those scary warnings we just talked about, isn't it nice to have an option that's generally really safe, even for kids? This is a much gentler way to go, and it's especially great for things like diarrhea caused by antibiotics. Now, of course, nothing is totally side effect free. The most common thing you'll hear from patients who start probiotics is a little bit of gas and bloating. And this is another fantastic teaching opportunity. You can explain to them that this is usually a good sign. It means things are starting to shift and rebalance in there.
Okay, so we've gone through the different tools. Now it's time to lock in the absolute core principles. If you walk away with nothing else from this, remember these 3 golden rules. These are the non-negotiables that will keep your patients safe.
Golden rule number 1, you're a detective, not just a pill dispenser. That means you use your eyes and your nose. What does the stool actually look like? Is there blood in it? Mucus? And just as important, check for dehydration. Are their eyes sunken? Are their mouths dry? Is their skin tinting? Honestly, the dehydration can be a way bigger threat than the diarrhea itself.
Golden rule number 2, and here we are, right back where we started. You must always have obstruction in the back of your mind. Remember, that little bit of liquid stool could just be what's leaking around a massive blockage. If you give a drug to stop that, you could trap all that pressure inside and cause the bowel to literally burst. You have to ask yourself, could this be a blockage?
And finally, golden rule number 3, never just blindly stop things from moving. You have to respect that diarrhea is often the body's way of protecting itself. It's that fire alarm again, screaming that the body is trying to flush out a toxin or some bad bacteria. If you just shut it off without figuring out what started the fire, well, the fire just keeps burning. Okay, so now you've got the framework. You know the different drugs, you know the big red flags, and you know the 3 golden rules. But just knowing stuff isn't enough, right? The real test is whether you can actually apply it when you're under pressure.
So, to really make sure this stuff sticks for your exams, I've put together a bunch of NCLEX-style questions all about antidiarrheals. Do yourself a favor and head over to nursingwithcharity.com.ng right now. Test yourself. Find out what you don't know before the NCLEX does.
So I'm going to leave you with this one last thought. The next time you see that order for an antidiarrheal medication, I want you to just pause, stop for a second, and before you reach for anything, ask yourself one question. Not which drug is ordered, but why is this happening in the first place? Because finding the answer to that question, well, that's what makes you a truly great nurse.